Good afternoon, everyone. Welcome to Stories of Health and Care. I'm Aisha Williams, and I'm the Global Lead for Healthcare Workforce Strategy at Johnson & Johnson, which simply means I have the privilege every day to partner with and to support nurses and community health workers as the very foundation of global care. As we all gather here at Aspen, we've all come here for inspiration, ideas, and solutions to try to fix our global healthcare systems and to find ways to have equitable, quality, accessible healthcare for all. And at Johnson & Johnson, we believe that healthcare workers sit at the very heart of this work as those who are closest to the realities of care, closest to the communities we serve, who have the insights and hands-on experience to be able to help us find solutions that truly will fit the community. And we know that healthcare workers have stories to tell. It's essential that we raise the voice of healthcare workers in forums like these, and that we champion them as leaders to advance our health equity and also advance our healthcare systems. An intervention is needed. According to the World Health Organization, half of the world's population lacks access to basic health care. The WHO also projects a shortage of 10 million health workers over the next 10 years globally, and that threatens to deepen the inequities that already exist. But there are things that we can do. To help bridge the healthcare gap, we need swift and sustainable support of our current healthcare workers and investment in the health workers of tomorrow. We need to advance health worker training and find ways to make sure that our healthcare workforce is representative of the communities that they serve. And we need to address the challenges that healthcare workers face so they feel supported and valued and can thrive in the work that they do. Excuse me. Shortly, you will hear from 4 storytellers who are leading across all of the areas that I just mentioned. Leaders who have found unique and creative ways to innovate and to reach people in their communities with better care. As we gain inspiration from their stories today, I invite you to consider not only the work that healthcare workers do, the innovations that we'll hear, but also the way that healthcare workers make us feel. Because anybody in this room who has experienced a healthcare system has experienced a healthcare worker. And whenever I have an opportunity, I like to share just my story and appreciation for healthcare workers. In recent years, I lost my mother to Alzheimer's disease. And speaking of nurses specifically, it was the nurses who helped care for my mother with dignity, with compassion, with love in her darkest days. It was the nurses who answered the questions that our family had with patience. It was the nurses who made it so that we never felt alone. And so we need nurses and community healthcare workers for their stories, for their innovation, for the way that they make us feel. And those are all important aspects of their impact. So let's hear from them today. Please join me in welcoming our moderator, who is Siyan Gadamu. I'm going to tell you the wonderful things about her as she comes up. Siyan is Associate Director of Fellowships for the Aspen Global Innovators Group at the Aspen Institute, leading the Healthy Communities Fellowship and Communities First Global Collaborative. A true believer in community-led solutions to address health inequities, Siyan is passionate about amplifying and supporting the innovation of community leaders all over the world. Please help me to welcome Siyan.
Hi, everyone. Thank you so much. Thank you, Isha, for that amazing introduction. So excited to be here with you and introduce you to the 4 storytellers today. We're about to hear from 4 health workers as speakers, Joelle, Michaela, Abby, and Dr. Dixon, about how they're closing the gap between communities and care. So to kick us off and learn more about health workers, key role in achieving global health equity, we'll hear from Joelle Burville. Joelle is a medical school student at Washington State University, and through online platforms, he's helped open the minds of thousands of others to reality of health inequities. Welcome, Joelle.
Something is wrong with Grandma. The fear in my mother's voice woke me up immediately, the morning of March 1st, 2006. Thousands of miles away, my grandma had been admitted to a community clinic for an apparent malaria attack. Growing up, Grandma was my siblings and I main caretaker, while my parents were out providing a better life for us as immigrants from Ghana, West Africa. Unfortunately, Grandma passed away from malaria because there was an untimely and delayed care for her to receive. But that moment became the first moment that I understood that healthcare disparities, albeit at that point on a global scale, existed in the healthcare field. And I made it my mission that day to go to medical school, to better understand how I could be a part of the solution to change the narrative. In medical school, from all throughout medical school and even before, I've been thinking about healthcare disparities. As a high school student at Yale in college, and now as a medical student at Washington State University. But it wasn't until the COVID pandemic hit in 2019 that I really began to understand how healthcare disparities can exist and how I could be a part of the solution. And I could never have been imagined becoming the medical mythbuster for the work that I now do online. At my medical school, myself and one other student were the first 2 Black students in our school of 200 students. And as I was there, I was thinking constantly about what it meant to be one of the few in a field that has less than 6% of Black physicians. I began to run for student body president. I started an SNMA project on campus, and I really tried to better understand how I could be a part of the narrative change. At the same time, the COVID pandemic hit, and my entire school went virtual. During that time period, I had a lot of time to think for myself. I heard about Ahmaud Arbery, the 25-year-old Black man that had been jogging down the street and was shot. I mourned George Floyd, who was killed by police. And I thought about what it meant to be a medical student, and I put on my white coat and I marched out in the streets during that time period. But I really wanted to better understand how I could make more change, systematic change on a larger level. And it happened one day when I was sitting at home, scrolling through my phone on Instagram. I came across an article that was entitled Racial Bias in Pulse Oximetry. And in the article, it said that Black patients are 3 times as likely to have inaccurate, overestimated oxygen saturation when a pulse oximeter is used. Pulse oximeters are devices that go on our finger, and they measure a blood oxygen saturation level. They're used everywhere. Oftentimes they're used in hospitals, sometimes they're even given to take at home. And at the time, the FDA was encouraging people to take this device home, but hadn't told people that there was this disparity based on skin tone. Studies afterwards actually found out that Black patients were more likely to be turned away from emergency departments because the pulse oximeter had a false reading. So at the time, I did what any Gen Z/millennial would do. I call myself a Zillennial. And I took to TikTok to make a 30-second video about what pulse oximeters were doing in my community. In 30 seconds, I started my video by saying, what does racial bias in medicine look like? This is a pulse oximeter, and I explained the disparity. I posted it and went to bed. In 24 hours, I woke up later, and I had over 500,000 views on that video, and thousands of comments from nurses and physicians and PAs and all types of healthcare workers saying, I never knew about this disparity, and I used it to fight every single day. And then there was patients asking, I wonder if this is what happened to a loved one or to myself. And it was my first realization that there were so many types of disparities like that that exist in the healthcare system, and that was just one of many. Another that exists that to this day continues to blow my mind is called the GFR equation. And I think a lot of people have heard about this now. But GFR stands for glomerular filtration rate. It's a measure of how well our kidneys work. If you have a high GFR number, your kidneys work well. If you have a low GFR number, your kidneys don't work very well. For decades, there's been a racial correction because of a false racist belief that all Black people have higher muscle mass that multiplied the GFR equation for Black patients, and only for Black patients, no other race. What that equation ended up doing was making it harder for Black patients to get access to kidney specialists, diagnosed with higher levels of chronic kidney disease, and getting kidney transplants. I made a video on this in 2020, before there was any media on it, before there was any attention, and it blew up again on TikTok. And people started following me that had chronic kidney disease, wondering how this equation could be changed. I was a part of the solution too, making sure to put out research and working with organizations like the Institute for Healing and Justice to make sure that we could change this equation and reach health equity. In 2021, a new equation was finally formed that no longer used creatinine, the muscle breakdown protein, and was race-free. And in 2023, the Organ Procurement and Transplantation Network said anyone that had the race-based equation used had to have their labs relooked at. One woman, Anise, reached out to me. She told me that she'd been following me for years and that she'd been sending all my videos about chronic kidney disease to her sister. Her sister had taken my video to her doctor. Her doctor had looked at it, found out that her patient was eligible to be moved on the kidney transplant list, and subsequently got her moved up 5 years on the kidney transplant list. In that moment, I learned that social media is so much more than just a tool for dancing or for sharing information, but it can actually be life-saving. And 2 months ago, I was invited on the Kelly Clarkson show to talk about this, and they surprised me by bringing out Anise and actually having the opportunity to hug her in person. For me, it's truly the most important moment of my life, and Anise, even though she was not the patient, is my most important patient to this day. But in everything I do, I think back to my grandma. She was the start of my health equity journey. And when I think about my future patients and the reason why I entered into healthcare, it's my grandma who inspired me with her indomitable spirit to be a change maker and to make sure that we can make healthcare better for all. Thank you.
Wow, could we give him one more round of applause? I think that story is so full of poignant moments of how much racial health disparities are still existing today. And so thank you again for all the work you do, Joelle. So next we'll hear from a community health worker. For those who may not know what a community health worker does, you're going to find out. Michaela is about to fill us in on the many hats that she has to wear to promote health. So Michaela Trujillo Baxter, please join us.
Health looks differently to different people. My mom was an administrative assistant for the judicial system for 30 years, but she was much, much more than an assistant. She was a peer mentor, an advocate, and a community health worker. She was the one that you would call if you needed things like a food box, a clothing donation, or school supplies, because folks in the community just simply couldn't afford those things. And as a kid, I remember running through the courthouse halls and trying on the dress robes of the judges with the scent of Cowboys cologne on the sleeves that I can still smell. Now, ironically, years later, a judge dressed in similar fashion would come to sentence me to 2 years in the Department of Corrections. And while this felt like a heartbreaking time in that moment, it was really my second chance at life. And I can still smell the aromas of prison, the smell of lemon disinfectant that cleans the floors, or the smells of oodles of noodles being cooked at the microwave. But watching a woman's heart break spiritually and physically from being disconnected or even terminated from their babies is the most excruciating thing that I've witnessed behind bars. And during this time I was serving my sentence, I was working on my own recovery. And I began to lead peer support and community health worker classes, although I didn't know that's what it was called back then. All I knew is I wanted to help the women of my prison community. Women who are mothers, daughters, sisters, just like yours. Women who are going to re-enter our communities as our neighbors and work at our local businesses. These women are learning to trust, love, and reunite with their loved ones and their community. And I connected deeply with these women because I am them. I too long to never return to prison and never see a brick wall ever again. And I also wanted to join my family around the Christmas tree one more time. And even now, 6 years into doing community health work, my greatest gift is just hearing thank you from teenagers who have loved ones who are currently incarcerated, just like I was. Watching someone's life change from dark gray clouds to bright lights of hope, it's like giving someone coffee on a cold day. Community health workers do more than just direct health services. And like my mom, I am the one that my community calls on for care that's outside the norm. For anything, from IDs to education to crisis intervention. But you need a certain something to do this work because these folks are tough. And that something is trust. And sometimes trust is just showing up and being there for people like you said you would, because often we aren't used to that. I know how I've been let down and been stigmatized. So having this trust in my community lets me know that I'm important. In a world where disease is now substance use, mental health, loneliness, and trauma, what services can we provide? Well, the care that I received that I needed the most wasn't what you might have thought. It was love. I needed to learn to love myself and love others. And giving this gift to our patients is giving them the empowerment to make better informed decisions that positively affect the mind, body, and soul. Healthcare means not only treating wounds on the outside, but treating the unseen scars on our spirit. We help anyone. We support anyone, people of color, returning citizens, immigrants, help them navigate these systems. And with a patient care navigator, a community health worker, or a peer support worker walking alongside our patients, these people now have an increased chance of living longer, healthier lives. We meet people where they are, on ground zero, and we provide an extra level of healthcare care. So what do community health workers need from you in the room today? We need support across healthcare sector to be authentically partnered with, protected, and respected, not utilized, used, and taken advantage of. We need you to advocate in the rooms and spaces and places that we're not yet invited to yet. Places where conversations are being had about us without us. And I have found my spirit in the darkest of places. But that is exactly what has led me to be here on this stage and share my story right here in Aspen with you today. And I will be helping folks achieve healthcare outcomes in ways that are important to them until my last days. Because I will always believe that people can change. Why? Because I have changed. Thank you.
Let's give Michaela another round of applause, please. Thank you, Michaela, for telling your story about the power of community health workers. Thank you so much. So now we're going to hear from a nurse who had a big idea to solve a problem she was seeing every single day. So from the Cincinnati Children's Hospital, Abby Hess.
So I walk into the room with my little 8-year-old patient who's about to have surgery. She's clinging tightly to her father's arm. Despite the best efforts of the medical team, her anxiety and fear are palpable. And she frantically tells me that she really doesn't want to go back to the operating room and have surgery. As a nurse practitioner with anesthesiology and a clinical researcher who studies preoperative anxiety, I see kids all the time who are terrified to go back to the operating room. Studies have shown that the highest point of anxiety for kids having surgery is when we roll them back into the operating room on that stretcher, and we place a mask on their face to have them breathe gases and go off to sleep. As kids begin to breathe in that strong-smelling air, they start to feel a loss of control, and some even push away and fight the anesthesia mask. While my team and I have many different interventions, we continue to see this scenario play out again and again. In the US alone, there are close to 4 million pediatric surgeries each year. And surgery is often a day that kids, and definitely their parents, don't forget. Every time I saw a child who struggled with going back to the operating room, it made me wish that I had a better way that I could help ease their fears. But it wasn't until my friend's little 3-year-old son, Owen, came for surgery that I actually had an idea of how to make this better. So when little Owen came for his surgery, I was worried that he might have a difficult experience. But thankfully, his mom found a way to make this really easy for him. You see, she knew that Owen's favorite story was the 3 little pigs. So she told him when he went back to the operating room and he put on that mask, he would get to become the big bad wolf. And he had to huff and puff and blow the house down. So when Owen got back to the operating room, he actually took the mask from the anesthesiologist, and he huffed and he puffed, and he was out like a light, several big breaths. As my friend shared this story with me, I was just captivated by her ingenuity, and I wondered if I could find a way to help recreate this sort of really engaging and just kind of engaging experience for any of my patients. What I imagined was creating a video game. And so I took out my phone and I started to scour the App Store just to see if there were any games that were already controlled by breathing. And I then created my first prototype, which I didn't even know I could do that, but I had a cousin that was like, hey, just make a prototype. I'm like, all right, sure. So I took an anesthesia mask and I taped a standard microphone headset to it. I plugged it into my phone and gave this a try. And this actually worked. So when I handed this game to my friend's little 2-year-old girl, she quickly picked up the mask and she started breathing. She giggled and smiled, and her parents cheered her on. Now, instantly, this game had transformed this scary anesthesia mask into a fun game controller. While I had never done anything in product development, with this little prototype in hand, and then with the support of my hospital's commercialization team, I set out to transform this concept into a reality. This seemed like such a simple idea, right? But I quickly realized that with medical product development, there pretty much is no simple, right? This project required navigating countless obstacles and barriers. It took us 5 rounds of funding, and it took us over 7 years to get to the finish line. But I'm incredibly proud for having persisted through the many challenges, because now we're using this product in routine clinical practice at Cincinnati Children's Hospital, and we have several sites that are early adopters. And in 2023, we officially signed a licensing agreement with a company to distribute our now patented product to hospitals across the nation. The greatest reward from all this work has been hearing the hundreds of stories from families and our clinicians about just how putting this simple tool into the hands of our parents and our clinicians has helped transform this moment of high fear and anxiety into one where kids can just calmly breathe themselves to sleep while playing a video game with little zoo animals. Looking back on this project, I think that being a nurse practitioner was super helpful because I had constant insights from our clinicians and the parents and the kids. They're super honest about whether they like things or not. And this feedback kept us moving in the right direction. But this direct connection between clinical care and product development, it often doesn't exist. In practice, nurses frequently struggle with products that actually complicate rather than improve our ability to easily help our patients. But thankfully, nurses are innovators. And when something doesn't work, we often create workarounds and even novel solutions. And that's really just to ensure that our patients get what they need. I never studied innovation in school, but solving problems at the bedside transformed me into an innovator. And this journey has now led me to become an innovation leader. So as chair of the Technology and Devices Committee for the American Nurses Association, I've had the opportunity to work with innovation thought leaders from across the country. One thing has become clear. As we all navigate this rapid development of these technology and devices that are exciting, but somewhat daunting, right? We really need the expertise and the continuous feedback from our frontline healthcare workers. But why are nurses in particular so important for this? Well, nurses, we are the largest group of healthcare professionals in the world, around 29 million nurses globally. We're also the end users of so many medical products, and we intuitively understand both their strengths and also their weaknesses. But most importantly, through the work that we do every day, nurses hold the health and well-being of humanity in our hands. And that will always provide a true north for guiding impactful innovation. Like the story about my friend's son, Owen, healthcare innovation, it's not just about advancing technology, but it's about deeply understanding unmet needs and creating human-centered solutions. When we empower our front line to become innovation partners and leaders, we can create a future for healthcare that will be game-changing. Thank you.
Let's give Abby another round of applause, please. Thank you, Abby, for reminding us nurses are innovators and that we need to be continuously giving them the platform and support. So I'm excited to welcome our final storyteller, Dr. Dixon Chipanda, a 2023 McNulty Prize winner and an Aspen Global Innovators Fellow. He's going to share his story of harnessing the power of grandmothers to really tackle the mental health epidemic. Welcome.
So, imagine visiting a small village in Zimbabwe. That's where I come from. And from a distance, you see a bench. And on that bench is a young person, aged 18, who is deep in conversation with an elderly woman, a grandma. But this ain't no ordinary grandma. This is a grandmother who is trained in the basics of cognitive behavioral therapy. And she's conducting a session in a village on a bench. Now, our world today faces an epidemic of loneliness, depression, and suicide in our young people. In fact, when you look at the statistics, for people aged between 16 and 26, suicide is now a leading cause of death. And according to the World Health Organization, every 40 seconds, someone somewhere is taking their own life by suicide. And to make matters worse, we don't have enough professionals in the world, psychiatrists like myself or clinical psychologists. In fact, when you look at the treatment gap across the globe, most folks cannot get access to see a psychiatrist. This really was the genesis of the work that I do. But let me take you a little bit back, right from the beginning. So during my formative years, working as a psychiatrist in a large hospital, I was convinced that only psychiatrists and clinical psychologists could truly make a difference in the life of a person who was struggling with a mental health condition. That changed when I lost a patient of mine to suicide. Erica was her name. Erica had been under my care for just over 3 years when she took her own life. I remember vividly Erica's mom calling me during one of my hospital ward rounds and telling me that Erica had hung herself from a mango tree in the family garden. Suicide is a painful thing for psychiatrists, but there was something particularly profoundly painful about Erica's suicide. It was visceral because of the story behind the suicide. See, Erica lived in a town which was like 200 miles from where I worked. And her parents knew she needed help. She knew she needed help. But they didn't have the bus fare to get onto a bus to get to the hospital where I worked. And it was only the equivalent of $10 US. And when I heard that story from Erica's mother, it broke my heart. And it got me thinking, and I realized that I needed to find a way to take mental health out of the hospital and into the community. And that really was the beginning of my work. So what my team and I do for the last decade or so, we leverage the wisdom and the lived experience of the elders in our communities, those with the battle scars of life. We train them in the basics of cognitive behavioral therapy with an emphasis on what we call behavior activation, activity scheduling, and problem solving. After we train them, we allocate them a wooden park bench in their communities. We facilitate referrals to the community. We support the grandmas using digital technology. And after 2 to 4 sessions, folks are invited to join a therapy group in their communities where they continue to problem solve collectively. Last year alone, over 200 people sat on a bench to receive therapy from a grandma in Zimbabwe. We have also managed to replicate this model. This is something I'm really excited about. We've replicated this model in a number of countries, and more recently in Washington, D.C. And we're about to start a replication in New Orleans. But this work is all rooted in research. We have over 100 peer-reviewed scientific publications, including clinical trials. In fact, our most seminal clinical trial shows that grandmas are a lot more effective at alleviating symptoms of depression than psychiatrists. But the other thing that is really important about this work is that we're tapping into a resource that is readily available in communities. In 6 years' time, the population of people aged 65 and above in the world will be approximately 1.5 billion. And I want to tap into that resource. People with wisdom and lived experience. Imagine if we could train every older person across the globe to provide therapy, equip them with a wooden park bench in their communities. That is my vision, to bring a friendship bench within walking distance everywhere on the globe. Thank you.
One more time for Dr. Dixon, please. What a moving story and a way of harnessing such of our elders in our communities. So now we've heard from our health workers, and they're innovating, communicating, and connecting, all with the side of improving health for their communities. I hope you take these stories of care back and ask yourself, what can each one of us do to really make health equity a reality? And how can we support innovators like them and the amazing work that they do? Thank you all for joining us. Please join us for the reception. We'll be right outside the room. And thank you again.
Talking away. Well, I don't know what I'm to say, I'd say it anyway. Today is another day to find you shying away. I'll be coming for your love, okay?